Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. What are the new drugs for the treatment of migraines? Migraine treatment. The newest novel drug, approved March 9, 2023, for the treatment of migraine is Zavzpret, zavegepant, nasal spray. Migraine prevention. The newest drug, approved September 28, 2021, for the prevention of migraine, episodic migraine, is Qulipta, atogepant. New drugs for the treatment of migraine. The newest drug for the acute treatment of migraine is Zavzpret, zavegepant, nasal spray. The newest oral drugs for the acute treatment of migraine are Nurtec ODT, rimegepant, and Ubrelvy, ubrogepant, both orally administered calcitonin gene-related peptide, CGRP, receptor antagonists, gepants. Another new drug for the acute treatment of migraine is lasmiditan, the first serotonin, 5-HT1F receptor agonist. The other new drugs for the acute treatment of migraine are novel formulations of older drugs such as sumatriptan and rizatriptan, belonging to the class of drugs called serotonin, 5-HT, receptor agonists, triptans, and dihydroergotamine, an ergotamine derivative. Sumatriptan is a well-established migraine treatment first approved in subcutaneous injection form under the brand name Imitrex in 1992. Sumatriptan is available in a variety of dosage forms, including injection, oral tablets, nasal spray, and nasal powder. Some formulations are also available as generics. Rizatriptan was first approved in an oral tablet formulation under the brand name Maxalt, and an orally disintegrating tablet formulation under the brand name Maxalt MLT in 1998. Both dosage forms are available as generics. An oral film formulation of rizatriptan was approved under the brand name Risafilm in 2023. Dihydroergotamine was first approved in injection form under the brand name DHE45 in 1946 and as a nasal spray under the brand name Migrainol in 1997. Some dihydroergotamine formulations are also available as generics. The following drugs are FDA approved for the acute treatment of migraine with or without aura in adults. Drug name. FDA approval. Company. Drug class. Dosage form. Administration. Risafilm. Rizatriptan. April 14, 2023, IntelGenx Corporation. Serotonin, 5-HT1B/1D receptor agonist, triptan. Oral film. As needed, adults may take a second 10 mg dose at least 2 hours after the first dose if needed, but no more than 3 10 mg oral films can be taken in a 24-hour period. Zavzpret. Zavegepant. March 9, 2023, Pfizer Inc. Calcitonin gene-related peptide, CGRP, receptor antagonist, gepant. Nasal spray. As needed, a dose, 10 mg into one nostril, no more than one dose to be taken in 24 hours. The safety of taking more than 8 doses in a 30-day period has not been established. Trudhesa. Dihydroergotamine mesylate. September 2, 2021, Impel NeuroPharma Inc. Ergotamine derivative. Nasal spray. As needed, a dose, 0.725 mg into each nostril, may be repeated a minimum of 1 hour after the first dose. Do not use more than 2 doses within a 24-hour period or 3 doses within 7 days. Nurtec ODT, rimegepant. February 27, 2020, Biohaven. Calcitonin gene-related peptide, CGRP, receptor antagonist, gepant. Orally disintegrating tablets. As needed, no more than 1 dose, 75 mg, to be taken in 24 hours. The safety of taking more than 18 doses in a 30-day period has not been established. Ubrelvy. Ubrogepant. December 23, 2019, Allergan plc. Calcitonin gene-related peptide, CGRP, receptor antagonist, gepant. Oral tablets. As needed, a second dose may be administered at least 2 hours after the initial dose, no more than 200 mg to be taken in 24 hours. Rayvow, Lasmiditan. October 11, 2019, Eli Lilly and Company. Serotonin, 5-HT1F receptor agonist, Diton. Oral tablets. As needed, no more than 1 dose to be taken in 24 hours. Tersamra, Sumatriptan. January 25, 2019, Dr. Reddy's Laboratories Limited. Serotonin, 5-HT1B/1D receptor agonist, Triptan. Nasal spray. As needed, no more than 30 mg to be taken in 24 hours, doses separated by at least 1 hour. Zembrace SymTouch, Sumatriptan. January 28, 2016, Dr. Reddy's Laboratories Limited. Serotonin, 5-HT1B/1D receptor agonist, Triptan. Subcutaneous injection. As needed, no more than 12 mg to be taken in 24 hours, doses separated by at least 1 hour. Onzetra Xsail, Sumatriptan. January 27, 2016, Avanir Pharmaceuticals Inc. Serotonin, 5-HT1B/1D receptor agonist, Triptan. Nasal powder. As needed, no more than 2 doses, 44 mg, to be taken in 24 hours, doses separated by at least 2 hours. Related questions: Ubrelvy versus Imitrex, Sumatriptan, how do they compare? Can Imitrex, Sumatriptan, cause rebound headaches? How often can you take Imitrex, Sumatriptan? New drugs for the prevention of migraine. The newest drugs for the prevention of migraine belong to the class of drugs called calcitonin gene-related peptide, CGRP, antagonists and include Aimovig, Ajovy, Emgality, Vyepti, Nurtec ODT, and Qulipta. Monoclonal antibody CGRP antagonists. The long-acting, large-molecule, monoclonal antibody CGRP antagonists work by blocking the activity of the calcitonin gene-related peptide, a neuropeptide that has been implicated in the pain and vasodilation processes associated with migraine attacks. Aimovig is a fully humanized monoclonal antibody that works by binding to the calcitonin gene-related peptide receptor. Ajovy, Emgality, and Vyepti are humanized monoclonal antibodies that target the calcitonin gene-related peptide ligand. Aimovig, Ajovy, and Emgality are all intended for self-injection using a single-dose pre-filled syringe or auto-injector. Vyepti is administered via intravenous infusion. Gepant CGRP antagonists. The gepants are small molecule CGRP antagonists that can be administered orally. They work by blocking the CGRP receptor. Nurtec ODT is a dual therapy used for both acute and preventive treatment of migraine. It is taken as needed for the acute treatment of migraine, and every other day for the preventive treatment of episodic migraine. Qulipta is taken once daily for the preventive treatment of episodic migraine. The following drugs are FDA approved for the preventive treatment of migraine in adults. Emgality is also approved for the treatment of episodic cluster headache in adults. Drug name. FDA approval. Company. Drug class. Dosage form. Administration, Qulipta. Atogepant. September 28, 2021, Ubrelvy Incorporated. Calcitonin gene-related peptide, CGRP, receptor antagonist, gepant. Tablets. Once daily. Nurtec ODT, rimegepant. Also approved for treatment. Biohaven. Calcitonin gene-related peptide, CGRP, receptor antagonist, gepant. Orally disintegrating tablets. Every other day. Vyepti, Eptinezumab JJMR. February 21, 2020, Lundbeck Incorporated. Calcitonin gene-related peptide antagonist. Intravenous infusion. Once every 3 months. Emgality, Galcanezumab GNLM. September 27, 2018, Eli Lilly and Company. Calcitonin gene-related peptide antagonist. Subcutaneous injection. Once monthly. Ajovy, sprayMigraine VFRM. September 14, 2018, Teva Pharmaceutical Industries Limited. calcitonin gene-related peptide antagonist. Subcutaneous injection. Once monthly or once every 3 months. Aimovig, Arenumabu. May 17, 2018, Amgen Incorporated. Calcitonin gene-related peptide antagonist. Subcutaneous injection. Once monthly. For more information, see Treatment and Prevention Tips for Living with Migraine Headaches. For a complete list of migraine treatments, see Medications for Migraine, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.